The question's now about prescription drugs. I want you to hear a little bit of this. Dr. Oz was talking about lowering drug prices. So I want you to hear a little bit of what he had to say.
I'm saying that as an American, you want to make sure this system is sustainable and is going to last for many, many more years so your businesses continue to thrive. We want innovation. The president spoke to that openly. Secretary Kennedy spoke about the fact that we're proud to be leading the path forward, but it's got to be a financial model that makes sense for us as well. And you spoke about your father, Liz. As a physician, and three of us on that panel that you see there are doctors, our biggest problem is when we tell a patient, because our Hippocratic oath is to help get people healthier. We give them advice, and we take care of their health issue, and then they're bankrupt. Let me give you a number on this. It's going to stun you. This is a Kaiser Family Foundation data point. 62% of bankruptcies, two-thirds, are caused by medical issues, health issues, some of them driven because you cannot afford the medications. In fact, 30% of people who are prescribed medications say they can't take those medications as prescribed because they can't afford them. That's not bringing health to Americans. Let the doctors, let the hospitals, let everyone involved provide the best care possible. Let's make it affordable so it's sustainable.
So that is the plan. He also talked about thanking the president for the executive order. And this is, I want you to hear President Trump talking about this. This is an announcement about this executive order, why he's signing it.
But starting today, the United States will no longer subsidize the health care of foreign countries, which is what we were doing. We're subsidizing others' health care. Countries where they paid a small fraction of what, for the same drug, that what we pay many, many times more for, and will no longer tolerate profiteering and price gouging from Big Pharma. But again, it was really the countries that forced Big Pharma to do things that, frankly, I'm not sure they really felt comfortable doing. But they've gotten away with it, these countries. European Union has been brutal, brutal.
All right, so here are the 5 most expensive prescription drugs in the country. Listen to this, Pablo. And now a lot of these are single-dose drugs, you know. So this is a drug, Lenmeldi, by Orchard Therapeutics. The medication is used to treat metachromatic leukodystrophy, a rare genetic disorder that damages the nervous system. It's given once and is supposed to stop or slow down the disease in young children. Okay, it's a single dose. How much do you think it costs for a single dose?
$250.
$250?
Yes, $250.
Okay. All right. That's a good guess. It's a good guess. It's a little higher.
$350.
$4.25 million.
Ay, my, no.
Just a little higher.
Yeah.
What? Wait.
Yeah. Yep.
What?
One dose.
There is a medication prescribed to people with hemophilia B. It's a bleeding disorder. It's a one-time treatment, helps the body make its own clotting factor so patients don't need regular infusions. It's called Hemgenix. $3.5 million for the single dose.
Those are expensive. I actually had a family member that had hemophilia.
Yeah. Crazy
stuff.
So if it helps, it's a one-time treatment.
One-time treatment.
$3.5 million.
I mean...
Elvidis, I don't. It looks ELE, Elevidis. I don't know how to pronounce it. It is a prescription medication intended for young boys. It treats a muscular dystrophy. It aims to slow down how fast the disease progresses. It's 3.2 million. Another medication used for a brain disease in boys is $3 million. And number 5 on the list is a blood condition. It helps to ease a blood condition that requires similar transfusions. It's $2.8 million. The 5 most expensive prescriptions based on volume they bring in each year in America. Mm-hmm. Keytruda is a $25 billion revenue in 2023 by the company Merck.
25
billion with a B. Bristol-Myers Squibb makes one called Eliquis, $18.95 billion. Ozempic, $13.93 billion.
Just kidding. It's just the song that costs that much.
And let's talk about that for a minute. For all the money that they make, could they do a better job of making some of those stupid commercials? Are they not the dumbest commercials on the planet? Those TV commercials?
I was thinking earlier, I was like, I would love to sing some of the jingles that we have here live.
No, I'm not talking. No, I'm not talking about the radio commercials.
I know,
I'm talking about the.
Oh, those commercials are insane.
You know,
they're ridiculous.
They're always at a farmer's market. You got some woman dancing because she takes Jardiance. You know what I mean?
And it's like, this medication may cause.
Oh,
and it has
yeah.
like
Oh,
all
my
of the
gosh.
list.
Yeah.
But at least you're not dying, you know? At least you don't have whatever your medication is doing. No, those commercials are a little much.
Yeah, they are.
They're always like doing something super active.
Yeah.
Riding bikes.
It's always an
But
old...
my IBS is not bothering me.
It's
Did you look at that?
Well, they would have the, what was the one? Cialis? You know, Viagra and Cialis?
Hey.
Do you remember the old Cialis commercial where it was an older couple?
And they're sitting in a bathtub.
2 bathtubs.
Yes, apart from
holding
each other.
hands.
Totally remember this.
Holding hands in 2 separate bathtubs, looking out over a cliff. I'm like, yeah, okay.
That was the commercial?
Yes.
I gotta look that up.
Yeah, I've seen that commercial before.
All right.
My favorite was the hover round. I can even see the Grand Canyon.
Yeah, that's hilarious.
Hover round. It's just like echoing.
Do you remember the Little Rascal?
Yes.
I'm a little rascal and my little rascal.
Thanks for watching the Mike Broomhead Show. Tap to watch and listen to the new season of Amazing Arizonans, a KTAR News podcast. You can also click the button in the middle to subscribe.